Welcome everybody to this Family for Every Child online event. My name is Amanda Griffith. I'm the CEO of Family for Every Child. Family for Every Child is a diverse global alliance of 40 hands-on practitioners, local organisations in 36 countries. As an alliance, we work with millions of children in extended family care, alternative care, detention, and those on the move or without adequate care in their own families. Our goals: preventing family separation, strengthening families, ensuring high quality alternative care when needed, and protecting children outside of any care. Our two most recent campaigns have been United for Boys, which was looking at the issue of sexual violence and how that impacts on boys, and Children on the Move. The subject today is on international approaches to the prevention of child sexual abuse. It's a How We Care online event, and thank you for joining us. This is the second in Family for Every Child's How We Care series of events. How We Care is a new initiative working to share local practitioner knowledge and tools across a variety of themes. Globally, it is estimated that up to 1 billion children have experienced physical, sexual, or emotional violence or neglect in the past year. The full scale of sexual violence is hidden because of its sensitive and illegal nature. Most children and families do not report cases of abuse and exploitation because of stigma, fear, and lack of trust in the authorities. Social tolerance and lack of awareness also contribute to underreporting. Many of our members at Family address child sexual abuse in their work, and it's linked to children's care. In this How We Care series, we have worked with 3 members to present the work they are doing to help combat child sexual abuse in their regions. Those members are Butterflies in India, Paicabi in Chile, and CPTCSA, the Center for Prevention and Treatment of Child Sexual Abuse in the Philippines. In this event, we will explore the tools and models of practice being used by these members to combat child sexual abuse. Hopefully, some of you will have had a chance to explore the materials of the How We Care web pages related to this work, which will provide more context to today's discussions and are available on our website. COVID-19, with its devastating health impacts worldwide, is also posing heightened risks for children to all forms of violence, including sexual abuse and exploitation, particularly children who have already been living in abusive families, those living on the streets, and those in closed institutions. It is estimated that more than 1.5 billion children have been impacted so far. Children have lost access to extended family, peers, school teachers, social workers, safe spaces, and other services to seek help for protection. On the other hand, many children are engaging in online learning and entertainment, which has exposed them to higher risks of cyberbullying and online sexual abuse and exploitation. Our members have also been faced with reports of increased cases of sexual violence in several countries and have been reaching out to children and families through innovative means of intervention. Many of the Alliance member organisations have also begun to redesign their existing sexual violence prevention and response services to cater to this context of COVID-19. I'd now like to introduce our panellists. Joining us from Butterflies in New Delhi, India, we have Rita Panaka. Rita is the founder and director of Butterflies in India, known for its core value of children's participation and innovative approaches to helping vulnerable children to change their lives for the better. Rita started work in the area of community health and women's empowerment. She has a master's degree in social work from the Tata Institute of Social Sciences and a master's degree in development studies from the Institute of Social Studies in The Hague. She has written papers and articles on street-connected children and co-authored a book on children and crime. From Paicabi, we have Valeria Arredondo Osandon, who is based in Vina del Mar in Chile. Valeria is the technical director and co-founder of Paicabi, where she has worked since 1996. Valeria is a psychologist and holds a Bachelor of Psychology from the University of Valparaiso, as well as a Master's in Social Psychology. She is a specialist in child and family psychotherapy. She is a researcher and has written articles on the topic of child sexual abuse. She has also been a teacher in areas associated with clinical interventions in childhood and family and sexual abuse in Chile. And joining us from CPTCSA, the Center for Prevention and Treatment of Child Sexual Abuse, we have both Zeni Rosales and Gina Lompero in Quezon City, Philippines. Zeni is a registered social worker, co-founder and executive director of the Center for the Prevention and Treatment of Child Sexual Abuse. She specializes in individual, group and family counseling. Zeni is currently the chairperson of the Subcommittee Against Sexual Abuse and Commercial Sexual Exploitation of Children of the Council for the Welfare of Children. She is also an active member of the Philippine Juvenile Justice Welfare Council. Joining her is Gina, is a licensed social worker from the Philippines. Since 2009, she has worked as a prevention program officer at CPTCSA, a non-profit NGO which works towards a safer world where children are free from sexual abuse and exploitation. Gina manages international funded projects on child protection. She has previously worked for various NGOs across the Philippines, which has involved community organizing and running child rights and child abuse prevention awareness sessions. I would now like to invite Rita, Valeria and Gina to give us an overview of their respective programs for the prevention of child sexual abuse, after which we will move into a question and answer session. So Rita, over to you first, please.
Thank you, Amanda and Family for Every Child for organizing this webinar, which is so very important, how we care. Butterflies, of course, has a full-fledged program on this topic, which is children and working on a preventive programs for children who are abused, sexually abused, but also when they are sexually abused, we do have a social casework program, we have legal work for the children and life skill education. So it's a full-fledged program. But here, today I'm going to speak about a storybook which we have published. It's called You Love Me, You Love Me Not. Now, what does the storybook do? How does it work? It's an illustrated storybook which presents the true life stories of 5 children, and these are children that we worked with, which are fictionalized. The stories are of experiences of sexual abuse within home, school, or in the peer group. The storybook guides children about disclosure and are supported in healing by supportive adults. Now, how do we use this? The storybook. To use the storybook, you really need an observant, sensitive facilitator who has excellent storytelling skills to read the story. The facilitator reads 1 story per session and reads out the stories to unravel the issues around sexual abuse. So it creates an environment of safety for children to explore the whole issue of sexual abuse, and it also helps the children to disclose and if they have experienced sexual abuse, and they're also given reassurances as to how that they would be caring adults that could take care of them. So it's a very, very an environment which really creates a comfortable an environment for the children to speak about sexual abuse, because as you know, in India, sex, sexuality, these 2 subjects are taboo. We don't speak about it. Now, what has been the impact of the storytelling? The sessions increase the confidence in children to share and report cases and seek support from school counselors and parents. In fact, after we started these sessions, there have been an increased reporting of cases. Parents found the storybook a revelation, and that was interesting. And today have conversations with their children and reassure them that they will protect and support them. Earlier, parents would not talk to children about sex, but today they are talking to them and they say, if anything happens, do let us know. They're talking to them about safe and unsafe touch. Teachers who attended the storytelling sessions and sessions on sex and sexuality spoke about their confidence to engage with students and their own children on issues of sexual abuse. Here again, in the school, you will not find the teachers taking any sessions on sex or sexuality, because as I said, it's a taboo, and the teachers themselves feel very embarrassed to talk about these sessions. But the storybook gave them that confidence, and they now use the storybook with the other children in other classes and grades. So, and interestingly, the teachers were able to even speak to their own children about issues of sexual abuse. Now we have found that the schools want us to take these sessions for children who are younger than 7 years old. And we are wondering how to go about doing it, because to do that, we need to have a different kind of methodology to be working with really young children. Butterflies does ensure that the schools have child safeguarding policies with clear guidelines for staff on how to respond to disclosures. And this is very important, because if that is not there, then it is disastrous. So we are helping schools to come up with child safeguarding policies and standard operating procedures. We also take training programs for teachers on how to handle cases of sexual abuse, how to be observant, giving them training in basic conversations and counseling too. There are requests from most schools, and we're not able to cope up with the demands, because there are more schools who have learned about this, about our work in 14 other government schools. So they're coming with more and more requests to take these sessions. So we are really overwhelmed with the response that we have got. But we have found that the storybook has been one method which was kind of a comfortable method, a safety method for children to really discuss and unravel these issues. Because as you know, children do not talk about it. They do not talk about, they have a lot of guilt feelings, so they don't speak about it. And when they do, sometimes they speak in a third person. So these stories really help them to speak about it, to know what they need to do when they are in a situation where they have been violated, sexually violated, what they need to do, whom they should approach. I stop here and I will wait for questions.
Rita, many thanks. I think you've raised two really important things. One is the importance of involving both parents and the wider family and the schools and the community in being part of providing that safe space for children to share and explore these issues, and also the really important issue of ensuring child safeguarding is in place when these topics are being raised, so that children can do so in a safe and protected environment. I'd now like to move on to Valeria in terms of to share with us what they've been doing in Chile.
Hola. Bueno, buenos días acá en Chile a todos y todas. ¿Se me escucha bien, cierto? Ok. Agradecer la invitación también de Family por poder compartir con las compañeras de Filipinas, de India, las experiencias de trabajo. Paicabi es una ONG que trabaja hace 25 años en Chile, Sudamérica, en la promoción y defensa de los derechos de los niños y las niñas. Especialmente nuestro trabajo está orientado hacia la vulneración grave de derechos de la infancia, por lo tanto nos hemos especializado a lo largo de nuestro trabajo con la temática de la violencia. Tenemos campañas específicas de denuncia temprana, de orientación respecto a los mitos vinculados al abuso sexual y a la explotación sexual comercial. También tenemos actividades de promoción y sensibilización, trabajo en red, que son dentro de nuestras principales actividades ligadas a la prevención del abuso sexual. Además tenemos programas que son de trabajo directo con los niños y niñas que han vivido abuso sexual. Por lo tanto, nuestro trabajo intenta hacer una combinación entre la reparación del trauma y la prevención de los traumas. Actualmente en Paicabi atendemos más de 3.000 niños y niñas en 21 equipos en distintas ciudades de Chile. Este material es una guía básica que realizamos hace algunos años, orientada principalmente al trabajo en la comunidad educativa. La guía tiene material formativo y práctilos para desarrollar en la comunidad educativa con niños entre 7 y 10 años, principalmente formando a los agentes claves de la comunidad, como son profesores, inspectores, directivos, apoderados, en el fondo con los adultos, para tomar ciertas temáticas vinculadas a lo que nosotros creemos que son los ejes centrales para prevenir el abuso sexual o para, pensándolo en la detección temprana y también en los aspectos educativos ligados al abuso sexual. Entonces, la guía se compone de 4 partes, una parte que tiene que ver con los fundamentos conceptuales para poder trabajar en el colegio, la escuela, ¿sí? Principalmente, que toca tópicos desde los mitos relacionados con el abuso sexual, los elementos que están asociados al riesgo del abuso sexual, conceptualmente qué es abuso sexual, básicamente. En la segunda parte, que tiene los fundamentos metodológicos relacionados con la aplicación de lo que van a ser los 3 ejes para trabajar la prevención, que son el abuso sexual como concepto, educación sexual infantil, que es la única unidad que se trabaja directamente con los niños, y cuidado o autocuidado en niños, que se trabaja con adultos, ¿sí? El eje del abuso sexual y el eje del autocuidado se trabaja con adultos. La tercera parte son la propuesta, en la guía está la propuesta de talleres específicos, se proponen 3 talleres, cada uno con 4 reuniones más o menos, con actividades específicas para desarrollar y también cómo evaluarlas. Y la última parte de la guía lo que pretende es proponer también materiales para que puedan trabajar, o sea, están las guías, las láminas para hacer los trabajos en cada reunión con los distintos adultos, profesores y también con los niños. Nuestro objetivo, más que sea aplicado el programa tal cual, exactamente como está ahí diseñado, es que una escuela, cualquier escuela, pueda tomar esta guía y adaptarla en los distintos contextos. Entonces va sugiriendo alguna manera de organizar este trabajo. Eso. Muchas gracias.
Thank you very much, Valera. And now if I could pass to Gina to tell us more about the work in the Philippines, that would be great. Thank you.
Okay, thank you, Amanda. Can I have my, yes, thank you for that. Okay, so in the Philippines, with the work of CPTCSA on the prevention of child sexual abuse, we have this core principle, which is everybody has the right to feel safe all the time. So that's the core principles of the Center for the Prevention, Treatment of Child Sexual Abuse, and the prevention of child sexual abuse in the Philippines. Philippines were a country in which 1 in every 5 children, equally between boys and girls, reported being victims of sexual violence at home, workplace, community, or during dating. So CPTCSA personal safety lessons, or also known as PSL, so it sits at the heart or the center of CPTCSA's work on prevention of child sexual abuse. So with a focus on and created for children, these materials is being used by children between the ages of 4 to below 18 years old. So the PSL aims to empower and inform children to help them better able to protect themselves and to build their skills and self-esteem to seek help when prevention is not possible. So the content of the lessons, can we move to the next slides, please? Okay, thank you. So the PSL also aims to strengthen and empower systems around the child and connect those who are in support roles, such as the parents, the teachers, the community members, the schools, and even the churches. So the lessons covered the safe and unsafe touches, vocabulary of their private body parts. It also covers the touching rules, the safety steps, and the support system for the child. So through the years that the PSL is being implemented, actually this is the primary implementer of this is the schools. So through the years, the CPTCSA developed other materials that will also cover other children inside the school and even outside the school. So one of this is CPTCSA collaborated with deaf volunteers, advocates, and teachers of deaf children to develop a deaf inclusive and deaf responsive child protection materials. So that's why we have also the personal safety lessons for the deaf. And because we believe the protection of children does not only covers a certain population, but also all children, especially those who have a special need, such as the deaf children. So aside from that, CPTCSA have developed materials for others to use that are based on both experience and research. So one of this is the my personal safety books. So this is a workbook for children ages 6 to 9 years old, and this is being used by parents, and the parents is the one who taught their children about personal safety lessons. And aside from that, we also have the Heaven of Grace. So this is a comprehensive child protection handbook for churches. So because CPTCSA believe that wherever the children are, they should be protected also. So that's all for it. Thank you.
Gina, thank you very much indeed. And I think importantly, what has really been raised here is from the Philippines perspective, is the equal numbers of boys and girls. And as you know, as Family for Every Child, we've been doing this major campaign and research into the issue of boys and how in actual fact that tends to be much more hidden. So it's interesting that your work, you're actually managing to identify and work with boys as well as girls on this issue. I think what's probably what will come through in the Q&A session, which would now I'd like to turn to, is also maybe during the course of those questions and answers, is to reflect on what's been the impact of COVID-19. So particularly, I know that we're hearing from many parts of the world that there's an increase in violence that's happening within the homes. So to what extent that you're aware of that, but also I think interestingly, in your examples, crucial to your dissemination is the engagement with schools, and clearly during lockdown one doesn't have access to that. So also to understand from you how you've been able to continue to do some work on these issues despite the fact that there's not a school. So I'd like to now open it up to those who would like to pose any questions to the presenters, and as I say, ideally if you could identify who you would like to answer the question, that would be great. Just to kick off though, what I'd like to do is just sort of ask Rita, can you just tell us some of the outcomes which you feel have been successful in using your storybook?
Well, I think if I were to say one of the major outcomes has been that the storybook is, is something that is so non-threatening for the children, and therefore they read it, and then the kids are able to not only understand what is safe and unsafe and where to go to, but also when the kids read and when they have experience of sexual abuse, they know that they don't have to feel ashamed, they don't have to feel guilty about it, and they really need to talk to their parents or to another adult who could help them. So we have found that, and it would be really, for us, it came like a major shock that in the 14 schools that we were working, in the last 1 year, apart from the storybook, of course, we take other sessions on sex and sexuality, there were 200 cases that was reported in these 14 schools, I mean, across these 14 schools. There were 200 where the children were really, they were either molested or they were touched in ways that was a violation. And that brought the school to understand the importance of having sessions with the parents. And therefore, we've been having sessions with the parents during the Parent-Teacher Association meetings. There is dedicated time period given to talk about these issues with parents, with teachers. And now we are talking about it with the communities. And so that you create an environment of safety and protection for children, because, Amanda, it's a continuum. You have a family, you have a community, and you have the school. And if all these three agencies do not create a protective and caring environment, then children would definitely fall through that safety net. And that's something that we need to create. So this has been one major outcome, that there were more cases reported, and there are more of conversations around this, and there are more schools who are now wanting to have sessions on sexual violence.
Excellent. Thank you, Rita. Very inspiring, and congratulations to Butterflies in developing such an interesting and sensitive way of working with children on this incredibly important issue. Valeria, you've also developed a guide which is slightly different. I wondered if you could describe what you think has been the main contribution of the guide that you use.
Sí, nosotros también hemos percibido que tal vez el principal aporte ha sido que los colegios, las escuelas que no se habían atrevido antes a enfrentar el tema del abuso sexual en la comunidad educativa, han tomado el tema, lo han puesto, insisto, como en los 3 estamentos, que es muy importante eso, de tal manera que no se sienta que es algo que amenaza un poco el hablar como de abuso sexual, como que amenaza, ¿no?, a la comunidad, porque puede ser disparar las cifras de identificación de casos, en fin, ¿no?, sino que es un aspecto que se va trabajando también con los adultos o tutores, padres, madres, ¿no?, y también con los profesores. Ahora, ahí ha sido importante el enlace con nosotros también como ONG, porque las dudas que presentan respecto a situaciones que ocurren en los talleres, nosotros no estamos directamente en los talleres los implementan ellos mismos, pero nosotros siempre estamos en algún apoyo a la comunidad en relación especialmente a lo que son las temáticas como de capacitación y asesoría. Pero luego, lo que ha pasado es que los propios colegios, las propias escuelas, van tomando la guía, hacen cambios, incluyen otras actividades. Habitualmente lo que les profundizan son nuevas técnicas de trabajo, especialmente con los niños, ¿sí? Porque el tramo de edad dice 7 a 10 años, pero uno sabe que un niño de 10 años es distinto a un niño de 7 años. Entonces van adaptando el lenguaje, la actividad didáctica que propone la guía a el contexto específico evolutivo de ese niño o esa niña. Entonces, esos son cambios que hemos visto. Pero yo diría que lo principal tiene que ver con eso, ¿no?, con ayudar al colegio a generar la temática, poner la temática dentro de sus propios lineamientos, de sus propios programas básicos, ¿no? Y eso ha sido muy importante.
Thank you. That's really interesting, and I think that sort of what's quite interesting in terms of the 3 examples is working with different age groups, and exactly, Valeria, as you say, the importance of matching the material to the age group that you're working with, so that it's both relevant and sensitive to the stages of development of the different children, and picks up a little on Rita's point that the request to start to work with 7-year-olds requires a different type of approach to one that working with potentially adolescents. And Gina and Zeni, I wonder, in terms of your sort of picking up on the COVID-19 and the lockdown in schools, or the difficulties of accessing schools at the moment, is how have you been delivering your personal safety lessons program during the pandemic? What's been the way of taking that forward?
Good evening from the Philippines. This is Zeni. I'm a colleague of Gina. Because of the lockdown, CPTCSA has to immediately really intervene when it comes to our programs, not only for the prevention, but for prevention in particular. We are right now we have an ongoing pilot by transforming PSL into online program. So we are now using virtual platform to continue our teaching on PSL. Gina is right now doing the piloting. She is from Manila, but our children is in the community and from different provinces in the country. And then a part of that, because we know that when you do prevention, there must be also a tertiary intervention because of the potential disclosure. So we are also now putting up our helpline where everybody can call for any concerns, not just sex abuse. And then are also putting up our counseling online. So everything that we do when it comes to prevention and treatment now is through virtual platforms.
And have you noticed any shift in terms of the calls to the helpline? Has there been any different topics or difference in the number of calls that you've experienced?
Yeah, it was in the beginning, we were really surprised because after the lockdown and up to now, we are already receiving around 100 calls. And before, in the past, we seldom got any call from people, but because of the lockdown, this number is already significant to us. And there are already case management work that we do online, like referring cases for forensic intervention. And there are already some cases where we're able to help, like ensuring that the offender will have no access with the child. So because of the lockdown, we thought we will not have more work, but I think because people cannot go anywhere for help, so they really resort to online help.
Okay, thanks. And you have a specific request also here. It says from the Philippines. So Zeni, for you is how can we refer possible clients from the Bicol area to your agency? So Zeni, I don't know if you want to type an answer to that. Can you see that question? You could type an answer to that specific question. And then,
okay.
Yeah, thanks, Zeni. And then another one that's there is that people are asking if it's possible to access these books that you've been utilizing. So I guess that's a question to all 3 of you. Rita, and first of all, is it possible to access an example of the book that you produced?
Yes, we do have a soft copy of it.
Mm-hmm.
And that could be shared.
Mm-hmm.
Of course, if it has to be in other languages, then it needs to be translated.
Of course. Okay, thank you. And Valeria, is your book available for others to access?
Sí, está disponible y además está disponible en la página de Paicabi también, www.paicabi.cl. Y además está en la versión en inglés y en una nueva versión un poco trabajada, editada por Family también. Sí, así que me imagino que estará por ahí la difusión.
I think it is on the webpage of Family as well. So that's so certainly accessible. And just to check with Zeni, is your material available online as well? The lessons.
Yes, everything that we have, you can see it online, but there are some requirements too for an guide on how you can adapt the program. So please go to our website because everything is there, and there are some instructions there on how we can work it out with you for those who are interested for the PSL materials.
And Zeni, I'm aware of the fact that you have also been producing quite a lot. You have a regular online update of materials that people can be using as well, that you're sending out as an organization.
Yes, we have a weekly activities for prevention and treatment activities, because we know that parents and children are bored. So we are providing them something to work out when it comes to child protection, and you can just easily download it. And they are very practical activities, easy to use.
Excellent, thank you very much. This is a question for Rita in Butterflies. Is teacher training a part of the Butterflies Storybook implementation? And if so, can you describe how teachers are engaged in implementation, follow-up and ongoing awareness raising? Are school parent committees engaged?
Yeah. Interestingly, when we take these sessions for the children, we saw that the class teacher would be sitting in the last bench and would be listening in. And the teachers found it so interesting that, but at the same time, they needed knowledge and skills to take these sessions. So they asked the school management that they should be training programs. So what we do is that we have a series of workshops, and we take a training in basic communication skills, because that's also very important. So basic communication skills, observations, and communication and counseling. So there's a whole module on this, in which we then take these sessions with the teachers. Once the teachers are trained, then we are there when they have a case which they find is very difficult and they can't handle it. They do call upon us, but we have also given them a list of other agencies that they can reach out to if they need help. So it's not just Butterflies, but there are other organizations too that they can reach to. Yes, what has happened is that there is more sensitivity, since you wanted to know what has been the outcome of all these training programs. There is more sensitivity around these issues, and the schools are taking the child safeguarding policy more seriously. At every academic year, at the beginning of the academic year, they have a whole session with all the teachers on the policy, but also the guidelines and what they need to do. So this has been our experience, that that the teachers are really far more forthcoming, and they really want to know how to deal with this issue, because it's so hidden in our society.
Thanks, Rita. And the other part of the question, which I know is something that you've done a lot of work on as well, is this engagement of school parent committees. Perhaps you'd like to just expand this bit.
What we have done is that, as part of our law, parents have to be, a few parents have to be members of the school management committee. And we have been able to dialogue with the schools to see that these very same poor, marginalized parents, that they should also be on the school management committee, and not necessarily the parents who are well off. So they should. And therefore, these parents are in the school management committee, and being in the school management committee, they are able to share some of their concerns with the management, have a discussion and dialogue with the management, and on issues of child protection and care of children in schools. So it's really, in fact, we did a whole an external evaluation on this, and it turned out that it's really sensitized the school management towards these children who come from the marginalized communities, which they wouldn't do before. But now they have, it's more inclusive schools rather than exclusive schools environment.
Excellent. Thank you, Rita, very much. I'm going to give another question to Valeria, and that is, how other, just in terms of the guide that you developed, you talk about how others have adapted it and how teachers have adapted it in their communities, but perhaps you could tell us a bit more about what you know about how other organisations have adapted your guide, and do you know of any learnings that have come out from that adaptation?
Claro, ha sido así, se ha adaptado y habitualmente lo que sucede, como les señalaba, es que el colegio, a veces el comité docente de una escuela, toma la guía y nos pueden llamar también. A veces no nos llaman, nos enteramos mucho tiempo después de que ellos han trabajado con ella. Lo importante tal vez en ese sentido es que el aspecto práctico es el que se ha modificado, es decir, toman las actividades que están propuestas en la guía y le hacen cambios relacionados con la didáctica. Por ejemplo, en la guía se propone el trabajo con un cuento también, ¿no? A propósito de lo que compartía la compañera Rita. Bueno, ese cuento estaba pensado para un taller, sin embargo lo han tomado en distintos talleres y le han hecho incluso cambios, ¿no?, al cuento para poder trabajar distintos contenidos. Nos han preguntado a veces y otras veces no. También hay un trabajo con tarjetas relacionadas con los mitos, en que han incorporado otros mitos que han surgido a propósito de la experiencia de la propia escuela con situaciones de niños o niñas que han develado abuso sexual dentro de la escuela o fuera de ella, pero la escuela se ha enterado de esta situación y que ha generado algunos conflictos, como por ejemplo estigmatización del niño o niña, de la familia también. Entonces han decidido incorporar o trabajar con las tarjetas, con mitos, con aspectos más específicos aún relacionados con esto que han observado en su propia comunidad educativa y que ha sido un problema, ¿sí? Tal vez ese aspecto de la estigmatización o cómo enfrentar las develaciones del abuso sexual en la escuela son un aspecto importante que también, bueno, esta guía va a tener una nueva versión este año, como de actualización, y ese es uno de los módulos que viene, ¿no?, relacionado como con el apoyo para las develaciones tempranas respecto al abuso, ¿sí? Entendiendo que a veces no es tan fácil separar en el trabajo directo de prevención lo que son los aspectos solo educativos con los elementos que son de detección temprana. Y digo esto porque nosotros no sabemos en una comunidad educativa si hay niños que están viviendo una situación de abuso sexual. Por lo tanto, cuando uno hace una actividad, tiene que pensar también que eso es posible, de que emerja en las actividades de talleres. Está investigado que eso sucede, digamos, que hay un porcentaje de niños que devela por actividades preventivas o actividades de sensibilización respecto al abuso o la sexualidad. Por lo tanto, esa es otra dimensión que también ha sido adaptada, ¿sí?, para poder trabajar con los padres y apoderados o tutores, con los propios niños también, y con los profesores. Eso.
Valeria, thank you. And I think you've raised a really important point, is that this is a topic that needs to be, needs to have a lot around it to ensure that it's undertaken in discussions with children in a very safe way. So Rita's referred to the need to have child safeguarding and ensuring that those safeguarding policies are not just in existence, but are fully implemented by the schools. But you've also raised the issue of the sort of whoever is facilitating those sessions needs to be aware of the fact that they are touching on potential experiences for those children in the group, and that there must be in place the potential to be able to handle any disclosure and ensure that those children are treated with care and protection, and any case that comes up from that is then taken forward through investigation. So I think for anybody who's embarking on working on this area, that it's really important that they're aware of the complexities and the necessity to have sufficient in place to ensure that what they're doing causes no harm to children. So thank you for raising that. I think that's really important. And Sunny, I was going to come back to you and Gina to ask you, what have been the main challenges in developing and implementing your program? Because I know that your program is now incredibly well disseminated and is part of the curriculum of many schools in the Philippines. But what have you experienced in terms of the challenges of getting to that point and implementing the program itself?
One of the major challenges in the past, because this is now a 20-year-old program in the Philippines, was getting the mandate of the government, especially the Department of Education. It took us 14 years for them to make a policy that PSL should be institutionalized throughout the country, in all public schools throughout the country. But even if it took us 14 years, but the work on the ground was were continued. So the experience from the ground, it was the teachers who really lobbied to the Department of Education for its mandate, because the teachers found it very effective and it really changes children's lives when it comes to their protection, and even for those victims who are able to help them. Right now, the challenges is, even if at present, even if it is already a policy of the department, knowing that this program requires requires funding, because one, it is a curriculum-based program where each school must have the complete set of the curricula from grades 1 to grade 6 for elementary, and first year high school to fourth year high school for the secondary. And the curriculum requires, printing the curricula requires money, funding. And at the same time, it requires also setting up the multidisciplinary team to support the implementation of the school and the trainings of teachers. So there are three types of training of teachers to teach PSL, and training of the multidisciplinary team, which are the police, social workers, lawyers, because every time we have PSL would really encourage reports. And in our experience, in every school that there is PSL, there is at least 5 disclosures. So, and we have 42,000 schools nationwide. So 42 times 5 is a lot when it comes to reporting. So right now, our challenge is how to make it really available to all schools. But we are now doing different modalities aside from the face-to-face, the traditional teaching of PSL inside the classroom. We are also, that's why we are really into now digitalizing the PSL, because we want this to be available online with a very minimal cost, that will put everything, the lesson plans online to be accessed by teachers. And then what we need only is to teach to train the teachers via online too, but with minimal online, minimal on-site supervision in partnership with the Department of Education supervisors. And another challenge that we want now, we want to turn this into opportunities. We want to be proactive. We are now working with the colleges and universities, education colleges and universities in the Philippines, where we want to teach child protection, or we want to mainstream child protection in particular with PSL, so that the future teachers are already somehow trained and they are already prepared before they become a teacher, because majority of them will join the Department of Education. So we are now exploring with the higher education office, the office who is in charge of the schools and colleges. We are targeting first the future teachers.
Certainly a brilliant example of how to gradually move from service delivery into systems change and managing to go to scale with a project, in terms of both, as you say, sort of enabling more to access through online, but then and not relying on you as an organization for the support and intervention, but then to really think about, so how do we integrate that into the curriculum for training teachers, means that you can really go to scale, which is fascinating. I wondered if I could just ask each of you in turn, but all three of you have referred to the fact that people avoid the topic, that there's a lot of stigma to this topic, it's very hidden, people don't feel comfortable talking about it. So what I think we're touching on there is something about social norms. And as we know, shifting social norms is probably one of the most complex and long-term pieces of work that we need to be engaged in. But clearly on this topic, that's essentially something that you are engaged in. So I was going to ask, Rita, I'll start with you again, if I may. If you can just give some of your insights about the sort of how one needs to start thinking about the social norms that are associated with this, and what changes we could start to think about that ensures that this is no longer a hidden taboo or topic, and children no longer feel there's a stigma associated with this, which of course will then really enhance both the number of disclosures, but also inhibit the number of actions in itself, which would be a really strong prevention. Rita, your thoughts on that?
Yeah, thank you, Amanda. It's a very long, drawn-out journey that one would have to take, especially in societies which are so highly patriarchal, and where the position of women have always been subjugated, and in India the whole issue of virginity is so highly prized, So when you speak about sexual abuse and sexual violence, in a society like India, which is so hierarchical, I think the challenge before us is that how do we, in a way, in a very child-friendly way, demystify this whole question of what is sex, what is the feeling of wanting to have a romantic relationship with someone, wanting to explore sex. Because what is happening in India is that with the legislation that we have on preventing sexual violence against children, we find that the teenagers, adolescents, that is from 13, 14, 15 onwards, those who are into romantic relationship, and this is the age when they are exploring sex, and if the parents of the girl finds out, they file a case against this boy that he has raped their daughter, and the boy is then, of course, he's arrested, and then he goes through the detention, and he's imprisoned, and everything else that falls. He gets into the criminal justice system. So we need to be discussing these issues, I would say, in multiple forums. You need to discuss it, I would say, not just the family, the community, and the school, but I would say that also in the media. Unless there is a different discourse that takes place in the media, that you need to be engaging with your children, you need to be talking to the children about issues around sex and sexuality. That has to take place. So there has to be a change also within the mainstream and vernacular media. The other is the entertainment industry. How do you what is your storylines? I don't know if you have watched any Bollywood movies, but in Bollywood movies, what you would find is that the hero would keep chasing the girl and would be stalking her. And she wouldn't, she in the first few scenes, she doesn't like him. And after stalking, after some time, you find that she falls in love and says, "I love you." So now what is happening is that some of the younger boys think that, yes, you can stalk a girl. That's accepted. So changing these kind of the social norms, it has to be in multiple levels. It will have to change. It has to change in your family, community, schools, the media, the general society, the entertainment industry, everywhere it has to change. And that you need to begin. So when we speak about it, and that's where I would say that Family for Every Child, taking up this whole campaign on United for Boys, is one of the ways forward to be discussing about boys themselves. I mean, they get sexually abused, but their perceptions on sex, sexuality, and masculinity is equally important to be addressing. And that's a campaign that family has taken. And I think that is something which is so, so very important in today's world. You know, how do we, bring about that, change will happen many years later, but you need to start the dialogue. You need to start the discussions. And that's where I think a lot of us, the CSOs, the government, the media, the parents, the ordinary communities, the children, all of them, need to be a part of this whole dialogue and discussion. I can go on for a long time, but
that's a fantastic call to action on which to close this session, Rita. Thank you for that. Highlighted the need. We have 47 participants. I hope every single one of you now take that up, that call to action that Rita has put on the table for us all to bring about a change to social norms. So I just want to thank Valeria and Gina and Zeni and Rita very much for sharing your inspiring work. 3 very different approaches, but actually some really in common pieces of the importance of working with family, community and schools to support children to disclose and finding really sensitive mechanisms and ways in which to do that. So I hope for those that have attended this session, this has been suitably inspiring and helpful, and as we've said, that there is access to this material either through our website or through the website of the individual organizations. So I'd just like to close with sort of saying that we this is the end of this current event. Thank you, Rita, very much. Thank you, Zeni. Thank you, Gina, and thank you, Valeria, very much for sharing your work. Before we end, I'd just like to ask, could you please complete our final poll to share some feedback with us on today's event so that we can improve our How We Care series and our online events generally, as this is, we feel, a very important way for family and our members to communicate with other practitioners about the work and the challenges around the work that we do. We hope to see you again soon for our next events around the COVID-19 theme, and details of which will be shared with you soon, as well as our next How We Care event and series that will also be online. So thank you all very much for attending. I do hope you found this an interesting event, and thank you again to the panelists.